There are many different reasons caregivers do not vaccinate their children or return for the next dose. These barriers to immunization usually fall into four categories: immunization system gaps, such as infrequent or inconvenient outreach sessions; communication and information gaps, such as health workers with poor interpersonal skills; parental attitudes and knowledge, such as a lack of correct information about vaccines; and finally, family, economic, or cultural characteristics, such as when women are discouraged from traveling alone to bring children to sessions. Some barriers require improvements in service delivery, but they may also require more effective communication or community engagement. To address these barriers, it is important to first identify the root cause, then determine if that problem can be addressed by communicating or working with the community. If they can, then consider possible activities. In this video, we will review some important activities to address barriers to immunization through communication and engagement: educating caregivers, partnering with community leaders and other organizations to promote immunization, involving community members in planning, and training health workers to communicate effectively with caregivers. Let us start with educating caregivers. When barriers relate to lack of knowledge or misinformation, education is critical. When possible, try to communicate with caregivers directly. For example, provide one-on-one education during clinic visits. Use trained community volunteers as immunization educators. Volunteers can reach caregivers within the community or help review information at outreach sessions. Hold community discussions with caregivers. This is very important if rumors are leading to resistance in a community. Education should focus on providing clear and accurate information on vaccine benefits and safety, as well as how to access immunization services. Make sure you have educational materials, such as posters and pamphlets, to support these efforts. You can also find partners to promote immunization. Let us look at some ways to partner with community leaders, the media, and NGOs or other organizations. Set up meetings with community and religious leaders. Discuss the benefits and safety of immunization so that they can help share this information with the community. Ask if they have any concerns. When leaders are resistant, listen carefully to understand their perspective and provide information to dispel any myths or rumors. Ask for their ideas and help in promoting services in the community. Meet with teachers and school staff to share information on vaccines targeted to school-age children. Next, work with the media to help address immunization barriers. Develop mass media campaigns to spread accurate, positive information in the community, especially when rumors are leading to vaccine hesitancy or refusal. Sometimes media organizations may spread misinformation in the community. If this happens, reach out to those groups, share accurate information, and ask them to correct their previous stories. Partner with local media to share immunization messages and positive experiences from those who have received vaccinations. Finally, approach NGOs or civil service organizations working in communities with vaccine resistance or rumors. Ask for their support educating community members. Next, include activities to involve the community. Engage communities in the micro-planning process. Find out why they are not accessing immunization services and ask them to help come up with solutions that can be included into your plan. Through community discussions or household surveys, ask caregivers to identify convenient sites, days, and times for outreach sessions. Finally, Train health workers so they have the skills to communicate effectively with caregivers. Train health workers to demonstrate strong interpersonal communication skills. For example, they should ask questions, listen carefully to concerns, take time to answer questions, and always be respectful of a caregiver's customs. Train healthcare workers to provide clear and accurate information about the benefits of vaccines. Remind health workers to provide this information at every encounter, especially when caregivers visit the clinic for other reasons. Finally, make sure health workers provide key information to caregivers at immunization sessions. The purpose of each vaccine, any possible adverse events, what to do in case this happens, and when to return for their next vaccines. Now you know how to identify communication engagement activities to address immunization barriers.